Hello, my name is Brittany Seal, and this is my review of the cystitis case study from this week. My presenting patient is a 26-year-old female complaining of lower abdominal pressure and urinary frequency. My patient states that she's been to the office about 4 times this year for dysuria and has been treated for urinary tract infections. She's sexually active and is taking a pre for contraception. She believes her symptoms seem to occur within 12 hours after engaging in intercourse with her partner. She denies any GYN history and denies any history of any pregnancies. For her medication, she takes an omega-3 multivitamin and low estrogen daily. For her medical history, she has a history of UTIs and PCOS, no surgical histories on file. For her allergies, it's just for Cipro. Her family history, she has diabetes and her paternal grandmother, but otherwise negative. For her social history, she reports that she never smokes, uses alcohol occasionally, 2 to 3 beverages a week. She denies any illicit drug use. So for my subjective data, my patient is presenting with abdominal pressure and urinary frequency. She's experienced these symptoms 4 times this year and has been treated in the office. As stated before, the patient reports that the pain is about a 5 out of 10 on the numeric pain scale. She reports that it feels like a constant pressure in her lower abdomen that kind of radiates down into her pelvis. The patient states that nothing seems to make the pain much worse, but heat application has improved the discomfort. The patient is experiencing frequency with her urination and burning. She states that she feels like her bladder is never totally empty. The patient denies any irregularities with her stool patterns. She denies pain with intercourse, but she believes that the symptoms occur more frequently after. The patient states she's only had one sexual partner and believes she's not at risk for STIs, as she believes he's been faithful. They've been together for a little while. And she reports she's on oral contraceptive. They don't use condoms. So for her review of systems, for her genitourinary and GYN, she reports urinary frequency and burning, denies known recent exposure to STIs, declines utilizing condoms during intercourse, and her menstrual cycles come monthly and are regular, lasting about 5 to 6 days. All other systems reviewed were negative. So for her objective data, her height, she's 5 foot, 106 pounds. All her vital signs were stable, as listed in my note. For her general, she's just been well-appearing, healthy female, not in acute distress, awake, alert, and oriented. She's normal cephalic. She does have increased facial hair and hair on her arms. Otherwise, it's distributed normally on her head. For her cardiovascular system, she has a normal rate and rhythm. The S1 and S2 are present, and there's been no murmur noted. Respiratory has all been normal rate and rhythm, no accessory muscles. Her lungs are clear and equal bilaterally. Her abdomen's soft and non-tender, negative CVA tenderness. Skin's fine. Breasts are within normal limits. For her genitourinary, her suprapubic tenderness is present. She has no irritation or lesions, redness or rashes noted on her external genitalia or internal. Her internal vagina and cervix appear pink without lesions. She does have a clear, non-odorous vaginal discharge visualized that looks completely normal. So for labs today, we would collect a urine sample for a urinalysis, a urine culture, STD testing for gonorrhea and chlamydia, a CBC, testosterone level, and hemoglobin A1C, just because the testosterone and the hemoglobin might be off, causing bladder issues just because of the PCOS. So my assessment of her, she's an overall healthy female presenting with UTI symptoms. This is her 5th case, so it's becoming recurrent. She has mild suprapubic tenderness on palpation and complains of abdominal pressure. So her diagnosis is cystitis. So the plan for her is to educate the patient that when urine culture and sensitivity results come back, she should take her antibiotics as prescribed until the prescription is done. She should drink cranberry juice or cranberry supplements. She should never stop her antibiotics once the symptoms improve. She needs to wipe from front to back, educate on utilization of condoms and risk for STIs, and urinating after intercourse to decrease this risk. For follow-up, she will be contacted with her lab results, and she will only need to return to the clinic if symptoms return or do not improve after treatment. And she should be referred to a urologist just because they're becoming a bit recurrent. Thank you.